So, our community was heavily impacted by coronavirus when it first hit. African Americans are disproportionately impacted across many of the different life domains, but when the virus hit, what you found was it was ravishing the Black community. And you also found that oftentimes the communication that was coming through the Black community about the virus was false, it wasn't accurate. You found a lot of the information that was coming from our system providers or from our doctors or our governmental systems, it wasn't trusted. Covid19Black actually came about because of what I witnessed within the programs that Unity Care provides. We provide transitional housing for young folks that are in and aging out of the foster care system. And when the virus really came on the scene, what we found was a lot of folks just didn't think this was going to land in our community. I had a personal experience with my mom that wanted to go see her sister who was in a nursing home in New Jersey right in the middle when they were shutting down the airports. And she says, I'm prayed up, I don't need to worry about the virus. And so what you found was just a lot of false information out there about the virus. And so I decided to pull together some folks in the community, the Black Leadership Kitchen Cabinet, some other community members, and through Unity Care, we wanted to create an information campaign that allowed us to tell our own narratives, our own stories, but from trusted sources.
The Covid19Black organization has been just tremendous in providing insight and understanding and education to African Americans of every age. I sat particularly on the committee that reached out to senior citizens in our general area to inform them, because many of them got misinformation on the news and did not understand even the wearing of masks, when to wear it, when not to wear, the washing of hands, and all of these things were all brand new to many of our seniors. So we were able to help them, educate them, and support them in that. It has also affected the young people and everyday working moms and dads and people in providing them information, because so much information was coming from so many sources that people were confused. And particularly in our community, we wanted to be sure through the organization that they got the right information and that they could be as safe as possible and as healthy as possible.
I think it's helped save thousands of lives, because it is an effort that was really led by young people, speaking to young people who've been influenced by it, and also they've influenced their families, many of those who were educated as a result of the efforts by the Covid19Black crew and staff.
We've actually referred hundreds of people to the website alone, just so people can go there and get factual information. It's really been helpful. It's been like the cornerstone of our outreach project, our outreach to our community.
Coronavirus was a knockout punch for us. And what it did was it exposed all the other social inequalities that already existed heavy in the Black community. And so what this allowed us to do was be able to create opportunities to have these courageous conversations in our communities with our government officials, with our public leaders around the impact of coronavirus by exposing all of the other social inequalities and all the other life domains in housing, in health and well-being, and juvenile justice and education and employment, all of these other life domains where African Americans are disproportionately impacted in comparison to any other ethnic group.
I think as we gather together, we have to continue to do what we've been doing, and that is to build bridges to communities that have not had an opportunity to obtain the resources, or they haven't had an opportunity to get to the resources, to provide those resources, to provide health information so that our community can be the healthiest that it can possibly be. And so I think the continued efforts of what has been taking place through the organization, if those things continue, and as we get new variants and new understanding of the new things that are taking place, we'll be able to better educate them so that they can respond in healthy ways.